Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Vision is one of the most important senses a human can have, connecting us to the world as we know it. From vivid colors and beautiful landscapes to everyday functions like walking, reading, or driving, we rely on our eyesight to guide us through life. And that's exactly why eye care is so important. I'm your host, Lisa Sather. Welcome to this episode of Healthy Living for Life, a show dedicated to helping you do just that. We start this morning with Dr. Bill Haskett of Montana Eye Care. Dr. Haskett, welcome to our show.
Thanks, Lisa. Thanks for having me.
Thank you for being here. So let's start out this morning about eye strain, talking about eye strain. And a lot of folks get eye strain looking at their computers or their smartphones. Can you tell us a little bit about what they can do to help reduce that?
Yeah, there's a lot of things, you'll hear a lot of things talked about with ergonomics and body position, dry eyes and blinking a lot. The more we strain and stare at computers, the less we blink, the less moisture on the front surface of the eyes. So you're going to increase discomfort, redness. There is a little tip you can have while you're working at a device or computer. We call it the 20-20-20. For every 20 minutes at a computer screen, you can take 20 seconds to look off at a distance of 20 feet or more. So if you have an outside window or a long hallway, just something to fixate on, and what that does is it relaxes your focusing system so that your eyes strain less. But really a lot of it is blinking, having your device maybe down below eye level so you're looking down at it as opposed to looking up at it and straining your neck and your eyes. So,
thank you, that's good tips. I need to abide by that rule myself. So dry eyes can definitely be a result of doing a lot of looking at the smartphone or the computer. Are there other things that can cause dry eyes, and what can be done about that?
Well, the climate we live in is really not conducive for dry eyes. We live in a very high desert, dry climate, spend a lot of time outdoors. Different medications, antidepressants, blood pressure medications, anti-allergy medications, smoking, a lot of our environmental causes certainly will lead to dry eyes. So there's things you can do using over-the-counter artificial tears. You go to the pharmacy and there will be a myriad of pharmaceutical options out there over the counter, but discussing it with your eye care provider and seeing which eye drop is best for you to increase the hydration level, the oil level, and the health of the front surface of the eye. And you can get as extreme as putting plugs in the tear ducts to increase tear retention. There's even over-the-counter oral supplements you can take as well that have the essential fatty acids, the omega-3 fatty acids, fish oil, flaxseed oil, some of those things in them to increase your increase more of your tear production.
Well, great. So let's talk about eye drops for red eyes or irritated eyes. I'm guilty of this. And can you tell us a little bit about these eye drops and whether or not they have any adverse effects? And are there other ways to relieve red eyes?
Good question. I woke up today, no kidding, with a red, sore right eye. And I have a bottle of artificial tear, just a lipid-based, oil-based artificial tear in the counter or in the cabinet. I put a drop in, and I'm not kidding you, within 20 minutes, the redness had diminished probably 20-30%. A drop later, an hour later, it was down, 80%. A lot of people want that instant gratification of no red eyes. So the over-the-counter get the red out drops are generally designed more for allergies. And I tell patients that truly have allergies or some sort of allergic event, those are certainly beneficial to be used on the short term. Using them long term can increase, obviously brings the size of the blood vessel down, but it causes the blood vessels to lose their elasticity, and you'll actually get blood vessels that stay engorged and overdilated, and they're even worse looking than they were prior. And you can get to a point where you cannot bring them down in terms of shrinking the size of them. So they serve a purpose. There is a point for them to be used, but once again, not long-term and not daily.
Okay, great. Let's talk about sunglasses. Why don't you tell us a little bit about the importance of wearing sunglasses when you're outside, and why is that?
Well, sunglasses is very important for cutting down on UV. You've got UVA, B, and C. UVC, the ultraviolet rays there, are usually cut down and filtered out by the ozone layer. So we worry about the UVA and B. which can be very damaging, and that's what we're trying to block out of our eyes. So the sunglasses do that if you get the right ones. You know, you want ones that have 99%, 95 to 99% or more UV protection. There's different tints you can get with sunglasses. Some people prefer a certain color. Gray tints tend to keep colors the truest in terms of looking at different color schemes. Some people like more of a brown or an amber tint. But you know, the importance is there because obviously there's tissue in the eye. It increases the risk of cataracts, the onset of cataracts when there's more UV coming in. I worry a lot about the soft tissue around the eyelids themselves, where there's a lot of oil glands there that produce, going back to the dry eye, that produce a lot of the oil that helps to lubricate the front surface of the eye. So you can damage those glands by increased UV exposure as well. So they serve a purpose to protect us from wind as well, so that drying effect can be diminished. So we do talk a lot about them, even on gray days. Sometimes that's where a lot of your UV is coming in on an overcast day as well. So, you know, a lot of it is just knowing if you've got UV protection. Some people prefer polarization when they're out on the water to get those reflected rays coming off the water. The winter times are the worst too because of the reflected rays coming off the snow. So I think all year round in Montana, especially with our recreational lifestyle, it's definitely beneficial, and not only from internal eye structures, but external eye structures like the eyelids. So.
Great, thank you. We have about a minute left, so can you just tell us a little bit about smoking and how that affects eye health?
Smoking increases your risk of developing things like macular degeneration, puts a lot of damaging chemicals into the bloodstream, and it gets into that same blood that goes up to the eyes and can cause deterioration of the tissue around the macula, the retina. It also increases the risk and the incidence of cataracts as well, just from the smoke and the inhalation, but also the external absorption through the tissues of the front of the eye. So not good. It's like the whole, I tell people your body is part of the systemic health system. So anything you're putting into your body that's damaging is going to be damaging to your eyes as well.
Thank you. A lot of good information today. I learned a lot. Thank you so much.
You're welcome. Thank you, Lisa.
So after the break, we'll learn about what happens to our eyes as we age and some things to watch out for. Stay tuned. Welcome back to Healthy Living for Life. Joining me is Dr. Thomas Burbos, an ophthalmologist with Mountain View Eye Care. Welcome, Dr. Burbos.
Thank you.
Thank you for being here. So let's start out by talking about some of the normal things that happen to people's eyes as they age.
As we age, we have a couple things that we run into. Probably the first thing is the lack of focusing as we hit our 40s, requiring reading glasses or bifocals or such. Probably the next big event as we age is cataract production and the consequences of that.
Okay. So for those of us who have contacts or eyeglasses, how often should we go to the eye doctor?
Generally speaking, if you're in contacts, that's typically a yearly visit. Glasses depends on age and eye health and what other requirements might be needed to follow up that patient.
Okay. And for those of us who don't wear eyeglasses or contacts, is there a reason why we would need to go to the eye doctor every year or at all, or what would be the recommendation regarding that, and why?
Sure. That's always a difficult situation when somebody doesn't have a need for glasses, and so there's no real impetus to come in and be seen. We've pushed towards having people get a baseline screening at 40.
Okay.
Some of those are for glaucoma checks, other types of eye problems that might be picked up early that may not be noticeable in their vision.
Okay. And then, let's talk a little bit about eye disease. If you could elaborate a little bit on what the most common eye diseases are, and what are the characteristics of each of those? And again, just the most common things that you might see.
Most likely the high prevalence of cataracts as we get older is probably the most devastating condition that we deal with in the eye world. And treatment for that, as we lose our vision and can't correct it with glasses or contacts, would require surgery to remove the cataract and replace it with an intraocular lens to restore vision. Another common one as we're seeing our population age is macular degeneration, and unfortunately the consequences of that with vision loss, especially central vision loss. The good news with that is treatments have been coming and been around for a while now that have really helped slow that disease progression. Unfortunately, we don't have a cure yet, and hopefully down the road that will come, but I think with the new technology and new treatment options we have, we've sure been able to help people from being able to say, I don't have much to do to, hey, I've got an option that can keep you going for a while longer with vision.
Of those things you just mentioned, would any of those be more hereditary than others?
So cataracts typically are not hereditary. There are some types of cataracts that are hereditary, but for the most part, they're a normal aging process. Macular degeneration can be hereditary. Unfortunately, it's a multifactorial disease, so other things such as smoking, which is a big component of the cause for macular degeneration, as well as being out in the sun without sunglasses, UV protection, especially as a young age, which prior was not pushed very hard to wear sunglasses when you're younger, but I think we've all learned that that's important. But also as we get older, wearing sunglasses and protecting our eyes from UV. Also, diet plays a role. A poor diet, unfortunately, also increases the risk of macular degeneration. So it does have a hereditary component where we do see families with multiple siblings having macular degeneration, but then we also see people that show up that don't have any genetic history. Some of that may be that predecessors didn't live long enough that we actually seen some of these diseases, however, so some of that we may find is genetic down the road as well.
So someone that does have a family history that comes into your office, would there be something you would counsel them about that? You know, what would you tell them if that is present?
If it's macular degeneration, I think the big thing is getting regular eye exams. Also, if they do smoke, to encourage them to stop smoking. One thing we can do to decrease the risk of macular degeneration. But I think just regular follow-ups, because it's a disease, if caught early, we have a much better chance of preserving vision and maintaining good vision for a longer period of time.
Very good. So back to cataracts, regarding cataracts. So I have heard that potentially women have a higher prevalence of cataracts than men. Is that true?
I don't think there's necessarily higher prevalence. I think we do more cataract surgery on females because of the simple fact they were more willing than men to come in and get checked and get things taken care of, where men are more willing to let things go a little longer before they get it taken care of. But prevalence-wise, they should be about even.
Okay. We were talking to Dr. Haskett earlier about total body health, and one of the things that comes to mind is high blood pressure. Can you tell us a little bit about how blood pressure affects your eye health and kind of what to look out for with that?
High blood pressure is a disease that unfortunately doesn't have much for symptoms, so unfortunately doesn't get always treated or taken care of appropriately. However, those that do have it, I think the key is getting it under control, because it can cause problems, especially in the retina of the eye. We can have problems with blood vessels that can get blocked up or break due to high blood pressure and cause lack of blood flow to a part of the eye, and we can lose vision. We can lose vision completely, or we can use sectors of vision, so we're missing parts of the visual field.
Okay. We have about a minute left, and one of the things that I think is really interesting is exercise and eye health. I mean, is there anything you could speak to, regarding normal exercise, keeping healthy, if that affects your eye health in a positive way?
Oh, it sure does. Exercise helps with controlling blood pressure. It helps with controlling your other vascular risk factors, such as cholesterol. So all that does help the eye, because the eye is a very vascular structure and is affected by those things. So exercise is extremely important to maintain good weight, keep your blood pressure down, and keep your cholesterol levels under control. That's
great. Well, that's something for all of us to remember and keep in mind. It's a good motivator.
Yep.
If you have diabetes, you won't want to miss our next segment. Stay tuned. Welcome back. Let's discuss the topic of diabetes and eye health. With me is Dr. Thomas Burbos. Welcome back, Dr. Burbos.
Thank you.
So let's start out again by talking about diabetes and eye health. And I have read that people with diabetes have a 40% more likely chance to develop glaucoma. Is that true? Can you talk about that?
Sure. The thought originally was that diabetes definitely contributed more to glaucoma. A study that was finished up around 2000 showed that they do have a slightly increased risk of developing glaucoma, but not as high as we had originally thought. But it is definitely something that has to be watched with our diabetic patients as they go along with their years.
Okay, and let's talk about cataracts. So I've also read that folks with diabetes have a 60% more likely chance to develop cataracts. Is that true?
I think that as well is partially true in the sense that the patients that don't take care of themselves correctly with controlling their blood sugars and keeping their diabetes under control tend to develop cataracts sooner than somebody that does. If somebody does do good control on their diabetes, then their likelihood is much less of developing cataract, but it is an increased prevalence amongst diabetics to have cataracts earlier than we would expect.
So is it important for folks who have diabetes to get yearly eye exams, and is that something they need to pay attention to?
I think it's extremely important for a number of reasons, not just eye health, obviously, to follow on changes that can occur from diabetes and keeping the patient informed of where they're at and what may be coming up as far as treatment that might be needed. But I think the other important thing that a lot of people don't realize is the eye is a window, and that window allows us to look at blood vessels that normally would be covered up by skin, and we can look at them and determine what kind of damage has occurred. That damage correlates very well with other damage throughout the body, not only the brain, the heart, the legs as far as neuropathy, kidneys, but as well eyes. So that gives the primary care doctor an idea that, okay, if they're having these changes, then we need to reset our goals and lower our goals or get the diabetes under better control. I think that's helpful for a patient with diabetes because it's one of those diseases that if the blood sugar's up, they don't have much effect that day. They go, well, I guess it's okay, we'll move on to the next day. And over time, that becomes months, which becomes years, and the problem definitely increases for them with trouble.
So if someone with diabetes decides not to get an annual eye exam, are they running the risk of not potentially catching a condition earlier than they could?
They are. There are some problems with diabetic eye disease that may not show up with vision change that we can catch early. Some of that may require some treatment. Some of it may just be encouragement to the patient that, listen, we're starting to see some trouble. Maybe it's time we tighten up our blood sugar control a little better, maybe a little more exercise. Also, keeping their blood pressure under control, et cetera, is important.
So diabetic retinopathy, can you tell us a little bit about that and how it relates to diabetes control and that patient as a whole?
So diabetic retinopathy is a problem that occurs due to having blood sugars that are too high. Those blood sugars that are too high cause damage to blood vessels, typically smaller arteries and arterioles. And that damage over time can cause that blood vessel to either clot off or to break open and not be able to deliver blood to that area. So that area is at risk of not having enough oxygen and nutrients. So over time, that can cause diseases such as swelling in the back of the eye or blood vessel growth in the back of the eye, which requires treatment.
And what kind of treatments would someone have to go through for that condition?
So early on in diabetic retinopathy, it's more of a watch. If it's minor damage, it's more of encouragement to the patient that what we're seeing is damage from few years prior, not what's occurring at the current time. And I think that's also important for patients to understand that the damage we see today is not from you having a high sugar yesterday, it's from having high sugars over a period of time. And so that is encouragement. In the mild disease, as it progresses, there's basically two types of retinopathy. There's a retinopathy where there's swelling in the center part of the retina, which is our central vision that gives us our detail, and that can over time cause vision loss. In years past, the treatment options were laser, and as injections, which have come about due to macular degeneration, have also been extended into the diabetic retinopathy world. We found that these injections actually work as well and sometimes better than laser. So currently our treatment modality is to inject medication into the eye and to control the swelling, and that's worked very well. The other type of retinopathy that occurs is in the more peripheral part of the retina, where damage occurs to an extent that the body responds by trying to help that area by growing new blood vessels or making vessels that are there become leaky. If these new vessels grow, they unfortunately don't stay in the spot they're supposed to. They travel around the eye and can get into the front of the eye, and they can cause glaucoma. In the back of the eye, they can progress and cause fibrosis or scarring that can lead to detachments of the retina, everything kind of leading to a loss of vision that in a lot of cases can't be reversed, but in some cases can be at least maintained or stabilized.
Wow, that's really good information. So we have about a minute or so left. What would be then the best advice you could give to someone with diabetes to really take care of their eye health and overall make sure they're doing the best they can for that?
I think the important thing with diabetes is getting checked on a regular basis,
Okay.
not just eyes, but as well as with their primary care doctor or endocrinologist or whoever is helping with the diabetes. By keeping that sugar under control and by watching on a regular basis to see what kind of damage is occurring or not occurring, which I think is important, can help keep them kind of understanding their status. I think educating people on diabetes and realizing that what we do now is for 5 to 10 years from now, not for tomorrow. And I think that's the hard thing, is to get a patient to understand that, as well as to act upon that. We can always say, well, tomorrow's another day, we'll try tomorrow, or the next day, and again we start kicking the can down the road, and pretty soon it catches up to us. So by having the regular exams, following up, and bottom line is controlling their blood sugars.
Great. Well, thank you for being here. We
pleasure.
certainly appreciate it. Looks like we're out of time. I want to thank Drs. Burbos and Haskett. I hope you enjoyed the show. Until next week, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.